welcome to Winnebago County Health Department's TV show, where we talk about public health and we relate it to your health. We've got a full show today, so I'm going to jump right in and have our guests introduce themselves.
My name is Autumn, and I am a health educator at the Winnebago County Health Department. I work with the Rethink Alcohol Action Team, as well as the Rethink Youth Coalition.
And I'm Alana Erickson. I'm co-advisor of the Rethink Youth Coalition and tobacco prevention coordinator at the health department and coalition coordinator of Rethink the Lakeshore Tobacco Prevention Network.
Lots of titles.
Yes.
But you both mentioned in there the Rethink Youth Coalition. Can you tell me what that is?
Yep, so the Rethink Youth Coalition is a project of the Winnebago County Health Department. It's a youth-led coalition for youth ages 13 to 18, and they work to make Winnebago County a healthier place to live. And currently they're working on substance abuse prevention, more specifically working on getting an ordinance passed in the city of Oshkosh that bans all tobacco products in city-maintained parks.
Wow. You know, this is the first place that I've worked that they actually have had a youth coalition, and I think it's so important that when you're trying to influence people that you're inviting them to be part of the group or the planning. So how long has this been around? When did the youth coalition start?
Yeah, so the youth coalition stemmed out of FACT, which is a statewide youth-driven tobacco prevention movement. So it's youth across the state, ages 13 to 18, just working to empower other youth to spread the truth about tobacco. So they do work on media advocacy, peer-to-peer education, just doing work around the community and meeting with state and local leaders to spread the truth about tobacco. So FACT started in 2001 in the state. Currently there's about 30 FACT groups across the state, so we're one of those. And so the Youth Coalition stemmed out of that. In fact, students do factivisms, which are fact and activist projects, activisms. So they do different activities around the community to raise awareness about what's happening with tobacco, who's affected by tobacco. And one of those factivisms that the students started doing in 2014 was cigarette butt cleanups in the parks. So these cigarette butt cleanups, they went around to different parks in Oshkosh and were picking up cigarette butts, and they realized that this is a huge problem. And so they were picking up all of these cigarette butts, and I have a few examples here. So these were all the cigarette butts. We have many more jars back at the office. Cigarette butts picked up in Riverwalk, Menominee Park. They also went to the Opera House Square in Oshkosh. These are all cigarette butts that they picked up within just a half an hour at each place. So they realized this is a huge problem, and they wanted to do something about it. They were sick of having to clean up all these cigarette butts. So in the summer of 2015, they started researching a potential solution. And so they came across an ordinance that was a TobaccoFree Parks ordinance happening across different communities across the state and the country. So they started, that was their big project.
Wow. I mean, it's like, you know, it's smart to think like how, instead of keeping the same process going, keep picking up the butts, let's do something about it. So where did that go from there? What are they doing now?
Yep, so after they completed some research, they realized, like Lindsay said, that there are municipalities out there that have tobacco-free parks ordinances, and so the youth have been advocating for that. Back in July, they presented at the Oshkosh City Council meeting, and then this November, just a few short weeks ago, they presented to the Advisory Parks Board, and now city staff is currently working on drafting an ordinance to ban all tobacco products in city-maintained parks.
Yeah, and that's it's such a neat video. Thanks to Oshkosh Media here, they go around and tape a lot of these government meetings, and so we wanted to share with the audience that little segment of when the students are presenting to the City Advisory Parks Board, because it really shows them getting involved and trying to make a difference. So we'll switch over and take a look at that video.
Some more reasons why tobacco-free parks make sense. Parks should be healthy places for the entire community to relax and exercise and be safe and just enjoy nature. An increasing number of cities and counties in Wisconsin are now going to tobacco-free parks. And some other park policies prohibit smoking in the Little Oshkosh Playground, glass containers, and litter. Did you know that Juneau has a tobacco-free park ordinance?
good one. Some common myths with tobacco-free parks. The first one is that there would be no way to enforce a tobacco-free parks. But like Ray said before, this would be a low-level priority for the police department, and many tobacco-free parks are enforced through peer and self-enforcement. We would want to make sure that there's enough time to provide lots of education to inform all residents of the ordinance so that everyone is on board before it's actually implemented.
Another myth we found was that people have the right to use tobacco when and where they want. No court has determined that smoking is a constitutionally protected right. However, everyone does have the right to breathe clean air. Tobacco use is a public health issue, not a rights issue. Another myth we found was that restricting tobacco will lead to decreased use of Oshkosh parks. The majority of citizens do not use tobacco. Oshkosh citizens use parks to be active and enjoy time with their families. Tobacco use is neither a healthy nor safe activity.
So one thing that we wanted to note through discussions with Ray and Chief Smith would be the issue of cost. So we did speak to the mayor of Wisconsin Dells, who passed a tobacco-free parks ordinance 2 years ago, and their costs associated with the ordinance was purchasing 35 signs, which for them cost about $670. If implemented, we would look into potential grants and other funding opportunities to partially or fully cover those costs. And then the biggest cost associated with this would making sure there's enough education to inform all residents of the ordinance to prevent any issues with enforcement. That funding is currently available to cover those costs. My time as a tobacco prevention coordinator, that would be part of my job. Also with the Youth Coalition, they would be providing education to the community. And so that would include staff time, community events, doing town halls, media, any other education materials.
Some benefits of tobacco-free parks: it would promote a healthier community, it would reduce this harmful cigarette litter, it would prevent secondhand smoke exposure, especially to little kids in playgrounds, increase safety and well-being of park attendees and animals. It would be consistent with policies for school grounds and athletic facilities, and everyone using the parks can be positive role models for our youth because we don't want our youth to start using tobacco, and it would promote healthy community norms.
So that was a short segment of the City of Oshkosh Parks Advisory Board meeting the other night, where the students were presenting to the board, giving them advice on why they think we should move towards this ordinance. You can watch the entire meeting on Oshkosh Media's website. It's really neat to see the students stepping up and trying to have a voice and know that they can be part of this decision process. But is there a way for the public to follow, how this ordinance is moving along?
Yep, so if there are interested youth in the community, they can contact either myself or Lindsay at the health department, and we would love to have more youth get involved. We're very flexible with when we have our meeting times because we understand that the youth have very busy schedules. And so we really work around their schedules. Frequently we meet on Sunday nights or whenever they're free. And so we're also presenting at other youth-serving organizations like the Boys and Girls Club and Youth Go to try to get more individuals involved. And so that just shows that we really want to collaborate with other youth-serving organizations in Winnebago County. And so we've actually also started a group for the youth coordinators of those youth-serving organizations. It's just our youth engagement group. We recently had our first meeting for that, and so if there are any other youth-serving organizations that would like to get involved with that group, they can contact either Lindsay or myself.
So it's a way for everyone in the community that's kind of working with youth to think about how are you getting them involved? How do you keep them involved? Because we want their voice. Is that what I'm hearing?
Yep, yes, their voice is definitely needed. They have lived experiences and they're very passionate about changing their community.
Great. So as far as the tobacco ordinance, how do people stay up to date?
Yeah, so if people are interested in tobacco-free parks, we update our social media whenever we have meetings or presentations. So people can follow us on social media. We have an Instagram account, Rethink_youth, Twitter, that Autumn does live tweets during our presentations. We're at Rethink Youth Co. and Facebook at Rethink Youth Coalition. So we post regular updates and we'll keep people informed of what's going on.
Wow, great. So what about if the general public wants to support this ordinance, if they are in favor or, have comments for it, either way, who should they be going to?
Yeah, so we would welcome anyone who has thoughts on the ordinance to come speak at the either city council meetings or the advisory park board meetings if they're interested in learning more or want to share their thoughts with us. We're open to having them email myself or Autumn, but we'd love to have everyone in the community who would be affected to come speak at the meetings.
Good, great. Well, thank you both so much for coming and talking a little bit about the Youth Coalition and what they're working on right now. It seems like very important but fun work. Also, while you're here, Autumn, I wanted you to talk a little bit about another hat that you wear, and that's the alcohol team and the work that you do with them. So tell us a little bit about this Cheers course.
Yep. So to start off, the Rethink Alcohol Action Team is working to reduce binge and underage drinking rates in Winnebago County. And that coalition is made up of law enforcement, UW Oshkosh individuals, some students, the DA's office, Human Services, among others. And like I said, we're working to reduce binge and underage drinking rates. And one of those ways is through our Cheers training. Yeah,
so this Cheers training has been going on for a while, and I actually got the chance to sit in on one of them with Autumn, and we decided it had a lot of good information that we wanted to share with you guys. So we put together a short video that kind of shows some clips, and we interviewed one of the presenters. So we're going to flip over and give you a little taste of what one of those classes looks like, and then we'll come back.
I am Brendan Bonnet. I'm a police officer at the City of Oshkosh. I teach the Cheers course, which is also known as Responsible Beverage Server class.
My name is Autumn, and I'm a health educator at the Winnebago County Health Department. So I help coordinate the Cheers course, so I do all of the logistical things. Individuals who are interested in taking part in the Cheers class call me, and I get them all registered to go. I print all the materials and get everything together.
The purpose of the course is to teach people how to responsibly serve alcohol.
And during the training, they go over the exact process that they take to do the compliance check, so people are aware of the process. The purpose of this course is to change the drinking culture over time.
As a third shift officer, a lot of times my interactions with the community is a negative situation where somebody's been in trouble or is going to potentially be in trouble, and I saw this as an opportunity of having a positive interaction with the community. Currently teaching the class with Aaron Roberts. He is also one of the main officers that work in the bar district on Main Street. So we cover several different topics. The first topics we cover just cover basic knowledge about alcohol and society. Then we move into what to look for in someone who's had too much to drink, what you should do if you suspect that someone's had too much to drink, possibly they're incapacitated, what the police department's role would be in those types of situations. We then move into how to spot a legitimate Wisconsin driver's license or ID card. I will give you hands-on training, and then lastly we talk about local ordinances and state laws that apply to someone serving alcohol. If you are involved in the beverage server industry, you should take this class. That could be someone that works at a gas station all the way down to a bouncer at the bar.
It can definitely be an educational class. We've actually had a couple bars in Winnebago County contact us and ask if they could just send all of their bartenders to the Cheers course. They hadn't been caught or anything. They're just new bars that have popped up that they want to get their bartenders trained and ready to go so they don't fail a compliance check.
If you are not able to attend one of the classes that's hosted, you can make arrangements with the police department where I could come and have the class at your establishment, and all the way down to a 15-minute crash course in what a legitimate ID looks like and what to look for a fake ID.
Cheers is a course that the Rethink Alcohol Action Team helps put on.
The class is free, and that's put on by Winnebago County Health Department along with the Oshkosh Police Department.
So that clip showed a little bit about what a Cheers course is and where it's offered. We'll keep that up on our social media sites and our websites, so check back to make sure that you're up to date on the latest dates. Again, for 2018, we have dates set of February 7th, May 2nd, August 1st, and November 7th. But as mentioned by the officer in that video, if one of those dates doesn't work for you, he is willing to come to your establishment and work on another course timing or option that'll work best for you and your employees. We just want to make sure that everyone knows the rules and that we're serving the best that we can here in Winnebago County. So switching gears a little bit, my next guest here in the studio is Julia, and I will let her introduce herself. She's a new face at the Winnebago County Health Department, but definitely not to Winnebago County.
Yes, hi. Well, thank you for having me here. My name is Julia Salomon, and I recently joined the staff of the Winnebago County Health Department about 7 months ago. Prior to that, I was working as a community health improvement leader with Ascension, Wisconsin, formerly known as Affinity Health System. And then prior to that, I also worked for about 6 or 7 years with the University of Wisconsin Extension. So yeah, I've been working on a lot of public health projects, and finally I get to say, bona fide, I am part of Public Health Department as a public health planner.
Right, so it kind of seems like all of your previous jobs kind of led you up to be this public health planner. At our health department, can you tell them a little bit about what a public health planner is?
Sure. I primarily assist the different divisions in the public health department. I prioritize, strategize, evaluate the excellent work they already do. So I help them facilitate using evidence-based practices and results-based processes how to have a greater impact on the health outcomes of the community we serve in Winnebago County.
Yes, and it's been a great addition. Our staff is growing, and it's good to have you to take that critical eye. That's kind of a little short glimpse at internal, but external, I know that you do just as much. Can you kind of talk on that?
Sure. So first of all, I'm not the only person on staff that works with the community. There are some excellent staff members in our department that have been working with the community, with coalitions or groups who work on addressing particular health issues in the community. And again, I just lend my facilitation skills to help the coalitions and our staff members work collaboratively with the community.
Right, so that's kind of like the day-to-day. There are some bigger overarching projects that maybe aren't happening every year. Can you talk about a few of those?
Sure. So to get a better pulse of what the community is dealing with in terms of health needs, every 5 years, public health departments go through a process called community health assessment. And interestingly enough, healthcare systems in our area also have a similar requirement. Theirs is on a 3-year basis. So we've decided to work better together as opposed to work separately in silos. So we have combined with two other counties, and we have a tri-county Fox Valley Community Health Improvement Coalition. And it brings together 4 different healthcare systems and 5 different public health entities. And we work together to do the data collection together. We share costs together. And we get a better sense of what the community itself identifies as their perceived health needs. So it's really a community-led effort, and we're just one of those participants, and it's worked out very well working in collaboration.
Right, if you're all doing the same work, might as well be doing it together.
Excellent point.
So, it makes sense that hospitals have to do this, and there's been a lot of changes since the ACA law has come into play and all of that. Why is it important that public health is at the table or, a leader in this?
Right, so a lot of people think of public health as just disease or chronic disease or preventing disease, but there really is a lot more room for public health to be at that table. So for example, let's pick transportation, right? A lot of people think, well, transportation, you take the bus, to go to school or go to work, but what about taking the bus to go to your doctor? Or what about WIC recipients who are coming to our office for the much needed benefits that they receive? How are they getting those services? So when we talk about transportation, the Public Health Department really takes a bird's eye view and says, well, what are the issues affecting access? And access to health, access to clinics, access to doctors. And so all of a sudden it does become a public health issue.
Interesting. So how, it's kind of obvious when you're part of these coalitions that are very health basic, but how do you get on the table of a transportation issue? How are you breaking those doors down?
Sure. So community work takes a lot of trust, a lot of open communication. Our community members know the excellent work that our department does already. So I cannot take credit for opening those doors, but it's through open and honest conversation. It's through not having turf issues and saying, we're in this together. We want to solve this together. We want to be a leader together in solving some of these issues, or at least addressing them, and hopefully showing impact and improvement in health outcomes. So even, for example, how we use the land in our communities, land use decisions. Well, there are public health implications there. So we sometimes ask, hey, have you thought about the public health implications in your land use decisions? No? Let me tell you a little bit more how we can be a really good collaborative partner. And so really it's all about trust and open communication.
So some of the partnerships that you're really working on now or have already been established, I know that they're doing some really neat things with the Oshkosh School District, a lot of the school districts around here, and mental health. Can you talk about any of those that you're really trying to beef up or that surprised you since you came?
Sure. So for example, going back to that community health improvement plan that we do, we identified about 5 different public health or community health priorities. Actually, when I say we, I mean the community. And mental health and access to mental health was one of them. And when we look at all aspects of mental health, we look at mental health in the adult population, mental health in youth, and we have heard that the youth are really struggling, whether it's the presence of social media or the pressures of just going through adolescence or whatever. And so we take a look and say, okay, what are some things, or who are those partners that we can work together to really dig deeper into what is going on with issues of mental health in our youth? And so an obvious partner, of course, when you talk about youth, are our schools. And our schools have been such a wonderful partner in helping us collect the data, analyze the data, and really be a partner in improving those health outcomes for our youth.
Right. It's such an obvious example, but there is sometimes some big red tape to cross, and it's really nice to see everybody working together in this county, and I'm very surprised at the wonderful relationships that go on there. So kudos to the community members, and may it keep going so that we can get more done. As you're sitting out there, you might be thinking, well, we're working on this project, we're doing some strategic planning, but we don't have health at the table. So Julia's a great person to start that conversation with, to contact the health department and see what isn't being considered, what other types of funding might be available, there's so many things that public health can touch on, and we have a great knowledge base with all of our staff. So go ahead and contact Julia. Why don't you share with them your email and your phone number?
Sure, it's a long email. It's JSALOMON @co.winnebago.wi.us, and it's probably on your screen. My number is 920-232-3038.
And we'll leave that up there on the screen for a little while so that you can jot that down. Thank you again, Julia, for stopping in and talking about this. It's a big concept, a big concern, but something that maybe we don't always stop to think about. what's the end goal? Where are we headed with this? And it's nice to have you take that critical eye and really help staff get to where they want to be.
Well, thank you very much.
All right, and so lastly on our show today, we have one last video for you. As we're approaching 2018, we want to remind you to make sure that you have your health insurance lined up. The healthcare marketplace is open for enrollment until December 15th, and you need to have all of your paperwork submitted by then to ensure that you have January 1st coverage. On that note, if there's other services such as mammograms that you are in need of, there are services like the Wisconsin Well Women's Program. And this video here can show you a little bit about the Wisconsin Well Women Program in our area and how you can enroll.
Hi, my name is Susan Garcia-Franz, and I'm the Wisconsin Well Women Program Coordinator located within the Winnebago County Health Department, and I cover a 9-county region that ranges with inclusion of the 9 counties being Winnebago, Fond du Lac, Sheboygan, Outagamie, Green Lake, Waushara, Marquette, Calumet, and Wapaka. So a little wide range there, but definitely full coverage in those 9 counties.
So you're explaining your large region. What is it that you do?
Sure. So the Wisconsin Well Women Program is a breast and cervical cancer screening program. We're primarily focused on women at 250% of poverty level or below that are on high deductible or prohibited from receiving diagnostic services. And so our program provides breast and cervical cancer screening, so mammograms and Pap tests, as well as diagnostic screenings that include diagnostic mammograms, ultrasounds, biopsies, and colposcopies when it's follow-up for a Pap test. And these are all covered under the Well Woman Program.
So, why screening? Why is it so important?
Yeah, prevention is so important when it comes to breast and cervical cancer because when we catch those early in women, the invasiveness of the treatment that they have to go through is so much less when we catch it early. So we find that, especially now with all that we have with Pap tests, HPV is one of the tests that's done when we catch cervical cancer early. A lot of times it can be an easy treatment versus something more invasive. So especially with breast cancer as well, we want to catch that early, if someone's feeling something.
Who's eligible for these funds, this programming?
Right, so primarily women ages 45 to 64. That age range is so important because as women age, their prevalence of breast cancer does increase with age, so we really want those women getting in 50 and above especially, but 45 to 64 or 35 to 44 if women are having breast issues. We also want them to call, and if they're under 250% of poverty level or they do not they're uninsured or underinsured.
So they identify that they want to get hooked up with this program. Where do they go? How do they get a hold of you?
There's a couple different ways. One, call us directly. We have a local number, it's 920-727-8650, or we have a 1-800 number, 1-800-807-0522. Those are 2 great ways. Another way would be go on our website. We have the website www.winnebagobpublichealth.org. There's a form to submit there, and that'll actually get a message to us.
So that form directly online, they can just submit their information and you'll receive it automatically.
Absolutely.
Great.
We have outreach materials to present, as well as we have brochures.
Another service of the Winnebago County Public Health Department.